So an 80-year-old boy is brought by his mother to the emergency department with complaints of severe bleeding from the mouth after dental extraction. Inquiry of history is that he is admits of easy bruisability. He recalls no joint swelling. He had a younger sibling who is a male, and he had died 3 years back with complaints of rectal bleeding. On examination, his vitals are stable, HB is 10, and otherwise platelet counts are normal. That is important. Bleeding time is normal, prothrombin time is normal. However, the APTT is elevated. Which of the following bleeding disorders the boy is most likely to suffer from? So clearly, even from the history only, we are able to make out that it is hemophilia. It is hemophilia. Why? We can discuss. So for starters, he's a boy. So X-linked disorders are being precipitated here, and because the mother gives the history and it looks like the mother is fine, and usually the children are affected, so boy probably maybe X-linked this thing. And complaints of usually characteristic of increased easy bruisability, increased bruisability, prolonged bleeding after any procedures, prolonged bleeding after even inserting or drawing a blood sample, inserting an IV line, dental extractions, prolonged bleeding will be present. And also, like we already discussed, hematomas, hemarthrosis may happen. Hemarthrosis can happen. These are like spontaneous things. Okay. So this he has denied, but otherwise the patient has both things, and he has a family history suggestive of it. He has a family history suggestive of it. Family history also is present. Okay. And lab evaluation wise, platelet counts are normal. Platelet counts are normal. So majority of the classic conditions like which he mentioned here, immune thrombocytopenic purpura may not be there. Bernard-Solier Wald-Bredben, yes, the platelets can be normal in these conditions. However, we can rule out bleeding disorders like immune thrombocytopenia, which are characterized by low platelet counts. So that is also there. Again, bleeding time is normal. Bleeding time is normal, so which says that again we have ruled out all platelet disorders, all platelet disorders. So platelet, more than platelet count, any platelet disorder, be it a functional or a quantitative platelet disorders, are characterized by prolonged bleeding time, are characterized by prolonged bleeding time. Hence we can rule out both of these. We can rule out both of this. Yes, von Willebrand disease, exactly, because von Willebrand factor releases like holds the holds the factor 8. So it is important, and kind of hemophilia pictures may also be present. However, though it is characterized by uh, increased APTT, it will also have prolonged bleeding time, because the von Willebrand factor help in platelet adhesion, and because this is not happening, because this is defective, bleeding time is prolonged. However, platelet counts may be normal. So this is also important, we have to see whenever we are discussing. So we have ruled out all platelet disorders, so the correct option is here, hemophilia. Hemophilia is characterized again laboratory wise, PT is normal, APTT will be prolonged. APTT will be prolonged because this is the intrinsic pathway. Intrinsic pathway. PTNR, PT is prolonged. PTNR is prolonged is when there is a factor 7 and factor 10 deficiencies, also tissue factor and factor 10, like in cases of vitamin K deficiency, because all hemophilias A, B, as well as C, factor 8, factor 9, and factor 11. So A, B, C, all are characterized by the factors which are involved in the intrinsic pathway. Hence APTT is elevated. All right. Thank you.